leadership can do for you. This is 10 News Nightcast.
Chest pain, dizziness, fear. You feel as if you're going to die. You're having a panic attack.
Panic is haunting more than 2 million Americans. But tonight, we're going to show you a unique 3D therapy that's giving panic disorder patients a virtual escape.
It started when the plane took off.
Keely Moore isn't afraid of a plane crash. It's the airplane cabin closing in on her.
I just felt kind of trapped.
Keely suffers from panic attacks, intense, unexpected episodes of fear. The attacks trigger severe physical reactions, including racing heart, chest pains, and dizziness. The attacks strike terror in Keely's mind.
The fear of dying, not knowing really what's going on.
The real-world situation is too overwhelming for a lot of people. This is a virtual elevator, so it's got...
People with panic disorder can face their fears head-on at the Virtual Reality Medical Center in Sorrento Valley.
So in virtual reality, we can put them in near real-world situations, have them experience that fear, teach them coping mechanisms, also teach them that those feelings aren't dangerous.
There are virtual worlds for most frightening situations.
Everything's starting to get smaller down there.
These 3D worlds work wonders for people with panic attacks.
I want her to get a little bit anxious, but I don't want to trigger a panic attack in her.
Virtual therapist Brenda Wiederhold monitors patients' heart rate and other bodily indicators that point to an impending panic attack.
The sensors on your wrists are going to measure your heart rate, so I'm going to see if your heart rate's increasing too much.
Please fasten your seatbelt.
This is the 9th time Keely has taken off in this virtual airplane.
As you can see here, her sweat gland activity hasn't increased during the flight, so she's actually able to use her coping mechanisms and decrease her physiological arousal, even during the takeoff, which used to be one of her most anxious moments.
Keely's 9 virtual flights have paid off.
It just feels more like excitement than it does really anxiety.
There are lots of situations that can cause panic. For me, just the anticipation of making a speech before a live audience makes me anxious. I'm entering a virtual world, putting my anxiety to a test. I'm telling my virtual audience about my early career. All right, I read news on a rock and roll station. I'm dating myself here, but you know, Top 40, KIIK, Kick News, Stereo Rock 104. My make-believe audience isn't responding. They all look so bored. That's the thing that scares me the most. We're going to talk about health and well-being today. Oh, now they're all being rude, not even listening. I'm sure I'm sweating.
A little bit of an increase in the sweat gland activity.
I need to make them pay attention. So I'm finding the friendly faces in the audience and trying to ignore the ones that look bored. In time, my anxiety eases.
She's actually learning to gain control now.
It was only a virtual audience, but after a few minutes, it became real to me.
It becomes very real to some people, and the more they're in it, it becomes even more real.
Well, there's the payoff. Now, most panic disorder patients see a significant improvement in 4 or 5 sessions. Dr. Wiederhold says the virtual world could trigger a panic attack, but she works closely with patients so they can control the situation. A big thank you to photojournalist Mike Inneman. For more information on virtual reality therapy for panic disorder, just log on to our website, thesandiegochannel.com.